God, I'm having flashbacks to my fight with Chris Avila.
Oh gosh, so to start off with, we can see that she takes a slice to both ankles. And the main worry here would be whether he sliced through both of her Achilles tendons, which are the main tendons that attach your calf muscles to your feet, enabling you to walk. Now, I've seen a few injuries like this, and a simple test that I perform to see if the Achilles tendon's completely torn is what we call the calf squeeze test. A normal test would be that I squeeze the calf and you see the foot move, and an abnormal test would be that the foot doesn't move while I give it a squeeze. And if this test is positive, the patient will need an ultrasound scan to check the tendon, and if it's completely torn, they'll need surgery to reattach it. Even with that, you won't be walking right for quite a while.
Oh, is that the Gucci store? Oh, it's the Vucci store.
Mita!
Oh! Yo, you saw the brain? That's a concussion right there.
How many are there? Allies and their locations.
Oh, he's made of steel. I want to be that strong one day.
Number and locations of your allies. Now!
Oh! He said, "What up?" He got kicked, he ate it. He got sliced, he ate it. But he still needs to wrap a little bit of fabric around his knuckle. God forbid it gets cut. I'm just saying. I'm pointing out the hypocrisy. Sorry, anime.
The number of your allies and their locations.
I told you, I don't know!
Oh. Oh, man. Hit him in the abdomen and he's bleeding. That's a bad sign. Not gonna last long, bleeding into the retroperitoneum.
I'm sorry.
That's the first time the dogs run today! And with that, the fight has begun! He's down! John's down!
We have a swift kick to the nuts. I think that's an excellent self-defense strategy, but Muhammad Ali Sr. wouldn't be too chuffed with the sportsmanship involved in that move. Trauma like this to the testicle can cause a testicular rupture, so opening of the testicle contents inside the scrotal sac. Thankfully, pretty rare. I've never seen it, but it would require surgical repair. And time is of the essence to save the testicle, so if it does happen to you, don't wait around.
Oh, and next up, we've got a kick to the abdomen as well as the lower ribs. Again, I've seen many people come in who've taken a kick like this and fractured several ribs, which can be incredibly painful. And the other thing to consider is damage to the underlying organs, specifically the liver and the spleen. The dangers with a ruptured spleen is that it can lead to internal hemorrhage, and a direct blow to the liver with sufficient force can trigger your vagus nerve, leading to a drop in your blood pressure and heart rate, causing you to lose consciousness.
God, I'm having flashbacks to my fight with Chris Avila. But see, I didn't fly like that.
You never get knocked down.
Never.
The harder they fall!
The bigger they are, the harder they fall. A bit of a, is that a compliment? When you get kicked in the nuts, where does it hurt? Okay, it does hurt around the nuts, but it also radiates up to the abdomen. The pain is actually referred there as that's where the testicles develop before they descend, so the pain still goes up through those nerves. Looks like there's been no lasting damage to the testicle there because the guy is up and at 'em.
Joe's really got some momentum going. He's got this.
I like that. So a fairly innocuous blow to the chin there, but this makes sense. The fact that this strike actually ends the fight can be explained based on the nature of the punch here. So this snapping of the head, so a rapid rotational injury, is highly likely to knock someone out. That's why boxers need really strong neck muscles and also to keep their chin tucked to stop this type of blow. When this snap happens, the brain is basically a big jelly suspended in the skull, twists on its axis, the brainstem, temporarily making you lose consciousness. And this loss of consciousness is a double whammy too, because he's unconscious as he falls. He won't have the natural reflex to put his arms out. So people have died from what looks like a fairly simple fall here from a traumatic brain injury and intracranial bleeds.
Mita-chan!
I guess the first thing to say here is that he's quite lucky that none of those nails have ended up hitting him, as I've seen many patients with nail gun injuries with nails in all sorts of areas. You'd really be surprised what people can survive with. The next point is that blow that she ends up taking to her chin, as we can see the brain getting smacked about inside the skull. And remember, with sufficient acceleration and deceleration forces on the brain, it can cause the brain to swell and even bruise. This can ultimately affect the way the brain functions, leading you to slur your speech, leading to difficulties of concentration, or even standing on your feet. And it's all these symptoms together that we end up calling a concussion.
Round to begin, and here comes Baki Hanma. Clocking in at barely 17 years old, Japan.
17 years old, I mean, it looks very much like what I did at 17 years old. I mean, he's absolutely ripped. I think he probably has a little bit of roids sprinkled on his cereal. Of course, you have to inject steroids, so that joke doesn't make any sense. Also, the anatomy here, yeah, it's broadly accurate, massively exaggerated. For example here, look at the bulges in the thigh here. So we've got vastus medialis on the inside and vastus lateralis, and peeping through the top, rectus femoris. So we'd very much see this type of definition in bodybuilders. So this dude definitely doesn't skip leg day.
Calling a concussion.
俺が楽しければそれでいいじゃん君もそう思わない
Oh gosh, so several stab wounds to the butt and to the inner thigh, as we see a good blood splatter come out of the wound. Now, if we look at the anatomy of the blood supply to that part of the body, you've probably got one of the largest arteries in the body going through that area, and that is the femoral artery, which goes on to supply the lower limb. Now, if that's been severed and left untreated, you could really bleed to death in a matter of minutes. Your best chance is to apply a tourniquet above the point of those lacerations to help slow down the bleeding.
We got a boxing anime. I'm already hyped. Yeah, he is. Yeah, he is. So when you're coming in like that and you have a size disadvantage, you gotta be ready to dip, duck, dodge, and dive. And then if you're the big guy, you wanna keep a distance, and they get close, you wanna clinch. Uh-oh. Uh-oh. Oh! Ah! Oh. Why do they fly when they box? Oh! This feels like boxing meets Pokemon fight. Oh, because he's got abs. Man, they're really slow punchers if they're being able to have this full-on conversation back and forth about what they want to do to one another. Yeah, but you can drop someone with a body shot. Just ask my man Ryan Garcia, who got dropped. Oh, body shot. He went right for the liver. He went bam. Bam. That's a weak spot for the body. Like getting hit in the liver just creates this reflex where your body just like go down for survival.
Here he is, Baki's opponent, Kaio Lee, the master of China's famed Yakuko Ken style Kempo.
We meet the opponent, Kaio Lee, who's got some weird stuff going on with his hand. Apparently this is the poison hand, although it looks more like a purpuric rash. Looks like he's got a swollen hand with a rash there. You know, the only time I've seen hands like that is people with meningococcal disease, very end stage meningococcal disease, where the rash is caused by the infection damaging the capillary blood vessels and causing bleeding under the skin. A very late stage, very life-threatening stage. But Kaori looks far too well for that to be going on. Cool, so first trauma, we see a strike to the zygomaxillary complex. That's the posh name for the bony part of the cheek. Could easily be fractured here, and then you'd be off to see a max fac surgeon, but first you'd rule out any kind of brain injury.
I love that her weapon of choice is a hammer, and really, as a weapon, this shouldn't be underestimated. If any of you out there have seen the Old Boy movies, you'll know what I'm talking about. But here we also get the introduction of NANAMI, and in my opinion, he's got one of the best character designs, as well as best choice of voice actors. And there we see that he's wrapping up his knuckles like a boxer. But why do boxers do this? So I guess firstly, and probably most obvious, is that it's to provide protection of their own fists. Ironically, one of the most common injuries that boxers sustain is actually a boxer's fracture. And basically this is an injury where the force of the punch is transmitted to the bones of the hands, causing one of them to fracture. And I guess the second reason for wrapping your wrists is that it helps with the alignment between your knuckles and wrist, helping to reduce any other injuries. Anyway, regardless of NANAMI's reason, it looks totally badass.
His left fist died. There is such thing as a boxer's fracture, which is really important to be dealt with because it can cause the hand to malfunction if left untreated. Oh, he's going up with the uppercut. Oh my God. Dude, if you have the time to say that, just put your hands up. In boxing, unless your opponent's super weak, loading up your punches is not a good move, says someone who likes to load up punches. I feel like an earthquake's happening, not a boxing match. Oh, why are they fighting on wood? Well, if I was ever to make a boxing anime, that's how I would do it too.
Poison hand. Direct hit.
Oh, that looks nasty. So a huge purple blister as a result of the just touching the poison hand. I mean, this looks like the type of reaction you get in a snake bite. The fluid is from the body's inflammatory reaction to that foreign material, and the fluid is building up between the layers of the skin, forming this blister. In reality, this swelling would take a lot longer, at 15-20 minutes to start appearing, and usually days to get really big rather than just sort of spring up immediately. But actually I'm talking about snake venom, and this is very much poison hand venom, so what do I know? Yeah, okay, nice. So this is definitely based on reality.
仲間の数と配置は
Oh God, a direct blow to the face, sending him flying. Now, with that level of impact, he's definitely fractured his nasal bone, and he may well have fractured other facial bones, such as the maxillary or zygomatic bone. And the danger with these kind of fractures is the profuse amount of bleeding, whether that's from the nose or going into the paranasal air sinuses. Now, sometimes a nosebleed can be so severe that it becomes life-threatening, and in those cases we perform what's called nasal packing, whereby we insert something that resembles that of a tampon into the nose to compress all the blood vessels. Also, looking just before the impact of that punch, I can see some sort of scale coming across his opponent's face. Has this got something to do with a specific power that NANAMI has?
Pincushion. pin in a pincushion.
それじゃ止血からね
Oh my god, is she about to suture? I see a tourniquet. Oh. Oh, where's the arm?
まずは左手から
Is she gonna full on do a reattachment of a limb? You're gonna need an orthopedic surgeon, a vascular surgeon, and she's like, I got this, solo. I don't buy it. The motions were too big for making the small amount of repairs that you need to do when you fix an artery. So I'm skeptical.
隠しといた方がいいかな。種も仕掛けもない。ただのスカーフ。バンジーガムで腕に貼り付け、ドッキリテクスチャーで肌を再現。
Whoa, that's like second skin. I mean, we have like tegaderms and stuff to cover skin and wounds, butterfly bandages, but we don't have this invisible cloak thing. Unless you do a skin graft, but even with the skin graft, you're gonna have sutures visible.
It used to be first aid advice to suck out the venom and spit it out in a hope to reduce the amount that's in the body. And you might think, well, isn't it possible to swallow it or get it in your mouth? But actually that's the definition of venom. So it's a poison that's injected in, whereas swallowing it doesn't tend to be that harmful. Although by sucking it out, it could enter the body through your gums or cuts in your mouth. Either way, the process of sucking venom out isn't recommended anymore, purely because by the time you've been bitten, it's already too deep and would be already in the bloodstream, so basically be pointless. However, again, we're not dealing with snakebite, we're dealing with poison hand, and actually it's probably more of a topical poison, so one that's on the skin and being absorbed that way. In this circumstance, maybe biting off part of the contaminated tissue would stop more of the poison seeping in and causing more damage. Although, as we said before, it might make things worse, because if the poison is rapidly absorbed through the skin, it could be even more rapidly absorbed through the gums.
仲間の数と配置はだから知らないんだ
And this is the very reason as to why a ponytail is a weakness in a fight, as we see that NANAMI delivers an earth-shattering punch to his abdomen. Now, the first thing I'd be thinking is how painful an injury would be like this, as that blow looks like it's directly hit the solar plexus, which is a group of very sensitive nerve fibers found within the abdomen. The second point is, unlike the injury we saw earlier, where they took a kick to the abdomen, this one is potentially far worse, as he's effectively being sandwiched between someone's fist and a solid wall behind him, which increases the risk of rupturing your internal organs like your liver and your spleen. If either of these organs do rupture, it would lead to massive internal hemorrhage and potentially death.
Okay, that's a weird looking creature. Why is everyone so ripped in anime? Like, I can't get that. I mean, maybe if you use steroids, which no one should be doing.
That's the idea, Pickle. Now you're starting to get the picture. That's just the kind of thing you gotta do in a test of strength.
Someone needs to explain to me or give me context of what's happening.
Uh-oh, here comes the ground.
Is this wrestling? Is that a vampire? A diesel vampire? Is there a pneumothorax happening? I can hear difficulty breathing from the blunt chest trauma.
Impossible. Pickle, maybe. But for Baki to still be on his feet after a fall from that height.
That's what I always say about Pickle.
I can feel my internal organs are in total chaos from the shock of hitting the ground.
That's called blunt trauma, blunt force trauma. But I don't know what he means by chaos. Like, is there massive bleeding on the inside? Because he's not going to be standing for a long time. You know, the same goes for Pickle.
My doctor.
Not quite sure what's just happened there. Has Baki just got loads of blows and they've been so quick we didn't see them? Or is he starting to get convulsions as a result of the poison? I'm not too sure. Okay, so wow, that is a massive hematemesis. I've pretty much seen this exact scene and in young people, and it's absolutely terrifying. Usually bleeding 101 is you apply pressure, right? But how the hell do you do that when someone's hosing from their GI tract? The short answer is there's not a lot you can do. You just got to get IV access, stabilize them as much as possible, and get them either to a scope or into surgery.
Internal hemorrhage and potentially death. Oh god, that direct blow to the face is definitely a fight finishing move. It's likely that that would totally have obliterated his skull, and the force of the punch would likely have been transmitted to his brain, leading to brain damage and possibly even brainstem death. But you know, just hearing this character's voice again, I think he's the same voice actor who's in To Your Eternity or Cells at Work. Let me know if I'm right down below.
It's crushing my lungs.
See, I knew there was a pneumothorax situation because they were doing that coughing. Oh. Oh, someone's about to vomit some blood. Oh, that's gonna create a GI disturbance. Swallowing that amount of blood is not good.
I'm spitting up blood. That means major organ damage.
Yeah.
I feel like I want to fall to my knees.
That means you have low blood pressure because you're bleeding internally.
So the obvious comparison again here is with snake bites. So some snake bites, I think we use the term hemotoxic or hemorrhagic venom, so they mess with your clotting. I don't know if you've seen those experiments where you get a vial of blood and put a few drops of snake venom in it and shake the blood and it turns very quickly into a solid. So this is going to send you into heart failure because your heart's not going to be able to pump that solid around the body and starve all your organs of oxygen. But what also happens in this process is all the clotting factors are used up in the blood. So the venom isn't clotting the blood, it's just activating your clotting factors. And with all those clotting factors used up, it means other parts of the body are just going to bleed. So you're going to get spontaneous hemorrhage. So a massive hemorrhage like this in someone with clotting problems is gonna be game over, and I don't mean game over in terms of a competitive fighting series, I mean the game of life is over.
Oh, we got a little soccer action.
Soar past my opponents was a joy given to me and me alone. I would outrun them all and eventually become the best striker in the world.
I wonder if Ronaldo says this to himself when he runs around. Oh, he tripped. He broke something. I feel like there's a ACL tear.
I'm sorry.
Is that a femur fracture?
We're looking at a right ACL tear.
Look at that, even in an anime I can make a diagnosis. But there's also the bone was broken.
If he were to experience a tear in the same place again, I'm afraid it would be difficult for him to continue playing soccer.
If you tore your ACL, you're gonna need ACL reconstruction surgery. Otherwise, you won't have forward support. If you don't have forward support, it's gonna be impossible to make good cuts. Like, yeah, sure, if you're older, maybe you could live without one, but not with what this person wants to achieve. Doesn't look like the brace that you would wear for this. You would have support on the side as well.
How'd you? That bastard. He's been healed!
That's a pretty miraculous recovery. The people I've seen that have been this unwell, you know, even if you stop the bleeding, they're still gonna, it doesn't give the blood back to them, does it? So although the process may have stopped happening, he still needs all that blood to be replaced before he's going to be jumping up and down again.
I feel so light. I feel so incredibly light.
Nice. So Baki's having a kind of euphoric experience here, tripping out a little bit. You may have heard of this type of thing being reported in near-death experiences, seeing a light, feeling like an out-of-body experience. Is it a trick of the mind? Is it the afterlife? Probably a bit too deep to be delving into in an anime reaction video.
I guess that the yin and yang poisons reacted with something in your body. Could it be the opiates your brain released because of your strong will to fight?
I think in the movie business they call this a exposition dump.
Well.
Hey everyone, Chiggery's back.
All right, come on, they could have done a better job. Oh, is that just captions? I thought that's how they wrote the sign. I was like, come on, it's vibrating.
You've worked so hard to get to this point. Don't push yourself.
Just take your time and ease back in.
Rushing rehab is one of the biggest mistakes athletes make.
What's the matter, Mr. Not So Genius anymore? Are you feeling winded? Ah, you scared to sprint. Wouldn't want to damage that knee again.
Is that actually a person, or is that like an intrusive thought personified?